Tonight, new concerns over the monkeypox outbreak. CDC officials have traced two versions of monkeypox now circulating in the U.S.
While they're similar to each other, their genetic analysis shows that they're not linked to each other.
New data from the CDC shows New York with 7 cases, California with 6, and Florida with 4. 2 of the cases in the U.S. were found to be genetically similar to that of a Texas man who traveled to Africa last year. The other known cases resemble the genetic signature of the outbreak of cases found in Europe.
They're both happening simultaneously, which I think reflects the fact that we've let monkeypox be out of control in Africa for an extended period of time.
Doctors explain that these are not variants in the way we think of mutating COVID-19 variants. Instead, these 2 monkeypox varieties are simply different members of the same family, each marked by symptoms including fever, headache, muscle aches, and exhaustion, along with the development of a distinct rash, often beginning with the face and then spreading to other parts of the body. It can spread when a person comes in contact with an infected animal or human.
That virus likely began to spread through person-to-person, close contact, possibly intimate or sexual contact.
Those who study viruses say the window is closing on possible intervention. A Yale epidemiologist suggesting LGBTQ organizations are the secret weapon here due to a current prevailing theory that at least some of the current spread started with attendees of LGBTQ plus events in Europe.
The more people that get infected, the harder it becomes logistically to be able to get to all those contacts and vaccinate them in order to stop forward transmission.
Experts say focusing on vaccinations in outbreak hotspots like Africa is the answer.
So it really argues for really putting resources, not just at containing this in Europe, in the United States, and in Canada, but also to be putting efforts into vaccinating people in endemic countries so that we don't have this reservoir to spill into other countries.
The U.S. currently has more than 36,000 doses of the vaccine Jynneos immediately available and has asked the manufacturer, Bavarian Nordic, to send 36,000 more. In the meantime, the CDC recommends using good hand hygiene, especially after contact with infected animals or humans.
People should not be surprised to see the numbers increase for some time, but it's still not something that poses a general risk to the public.
And Steven Romo joins us now from the studio. Steven, a lot of people are watching this and they are wondering, what are the chances of this becoming as widespread as COVID-19?
Very concerning, of course, whenever you hear something about a virus coming right after we've dealt with so many COVID cases. The short answer is there's really no reason to have that type of COVID concern that we would with monkeypox virus. For one thing, there is already a vaccine available. There's no development lag right now. There's something that's called ring vaccination. When there is someone who has a confirmed case, authorities will vaccinate the people immediately around that person to try to isolate them and protect the people around them to prevent the spread. So right now we just have more tools in the toolkit than we did with COVID, and also COVID is airborne and monkeypox is most often transmitted through touch. So a lot of differences right now, a reason to pay attention to it right now, but no reason for the concern that we have with COVID.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.